Hi, my name is Amelia Hunter, and I'll be talking to you about informed consent forms. Now, an informed consent form is a document that is fluid and often changing over the course of a relationship with your client. It is a safeguard that provides boundaries for yourself and for your client to uphold. Now, there's many places that, not there's many places, excuse me. The American Mental Health Counselors Association Code of Ethics states informed consent is ongoing and needs to be reassessed throughout the counseling relationship. So that just goes to prove that informed consent forms should be fluid and change often throughout the counseling relationship. Now, there's different items in a informed consent form, such as number and length of sessions, duty to warn, relationship goals, purposes, techniques, risk of therapy, as well as the counselor's credentials, and some confidentiality agreements. Overall, an informed consent form is meant to protect. It's meant to protect and to almost guide the counselor in the way that they should go with their clients. Now, one of the issues that is not on many informed consent forms was in the area of diagnosis. What to do when a patient is diagnosed and all of that good stuff. Now, the APA does say that it is necessary, it's a necessary cause to discuss with your client. In the article that I read by Kress, Hoffman, Adams, and Erickson, they too argue that diagnosis should be explained and outlined to the patient as they occur or become diagnosed. On the informed consent form that I looked at, I retrieved one from Texas. There was no area discussing diagnosis. I only wondered if that was because Texas is not allowed to diagnose patients. Now, ethically speaking, the form does contain many areas of protection. The number and length of sessions, duty to warn, relationship goals, purpose, and techniques, risk of therapy, and a few other areas. Most of these categories did a good job of covering the ethical issues that might arise in those areas. In comparison to the ACA recommendations, this form has done a pretty good job of meeting the needs of the informed consent. Missing from the informed consent form is the counselor's credentials, implications of diagnosis, and tests and reports. Each category holds its own unique importance to the informed consent form, although it's very hard to make sure you have covered all of your tracks and to make sure everything is stated correctly in the way clients can understand. Some of Florida's unique regulations is a regulation on confidentiality and privilege. Chapter 90 of the state statutes show and discuss the different types of confidentiality there are between a psychotherapist and a patient privilege, and the exceptions there that are listed. These laws map out privilege that the patient has and the exceptions to the rule. So like informed consent, there are laws that protect things such as confidentiality and privilege, which is something that's often discussed on an informed consent form. Overall, I've found that informed consent forms are definitely a necessary and good use of practice in your counseling practice. Thank you very much for listening.